want to talk about breastfeeding and alcohol. And this is a topic that comes up almost all the time, all right? This is one of those topics when I put it out there to say, okay, what do you guys want to hear about? This is it. And that's because, you know, parenting and breastfeeding is already hard, okay, and exhausting. And even when everything is going well, it's hard. It can be hard and exhausting. And, you know, putting unnecessary limitations on ourselves, it makes it only harder, okay? And when I say unnecessary, it's because we think that, and we've heard that breastfeeding is a no-no when it comes to breastfeeding. When alcohol is a no-no when it comes to breastfeeding, and this is actually not true. All right, but again, moderation. So let's talk about what's safe with breastfeeding and alcohol. It's one of the most common, but also one of the most divisive issues that comes up. But it's really important to understand the differences between pregnancy and breastfeeding, and that there are completely different recommendations. Lots of conflicting advice, lots of confusion around this. Let's look at what the research shows around breastfeeding and alcohol first, all right? What it says, let's talk about the American Academy of Pediatrics. I'm going to just read off what their recommendations do state. They say that the ingestion of alcohol should be minimized and limited to occasional intake. Again, back to moderation, of course, right? No more than 0.5 gram of alcohol per kilogram of body weight, and 60 kilograms or about 130-pound mom, that's about 2 ounces of liquor or 8 ounces of wine or 2 beers, okay? So that's what we're talking about when we say in moderation. We're not talking about getting drunk. We're talking about enjoying that cocktail, but doing it in a safe and smart way that is in moderation, okay? And then also you wanna consider when you are drinking. So try to do it like around 2 hours. It shouldn't be happening within 2 hours, or of actually, nursing shouldn't happen within 2 hours or longer of drinking that alcohol. You should really try to wait at least 2 hours after the drink to breastfeed your baby. The reason for this is because it's going to take that long for it to clear out of your milk, all right? And so if you really want to be on the safe side and not have any of it go to the baby, waiting 2 hours is going to be the safest amount of time, all right? Let's go back for a moment. I want to talk about the difference between pregnancy and breastfeeding when it comes to alcohol. You know, with alcohol, this one in particular, it's really important to understand that we don't recommend any alcohol when pregnant, okay? I know you hear different things and people have talked about, well, you can have a glass of wine. I don't recommend any alcohol when you're pregnant. We just don't know. We're talking about a direct blood connection between you and your developing fetus, and alcohol at any point during that pregnancy, we don't know what's safe. We don't know how much is safe, and we don't know at what point during the pregnancy could have an impact on your developing baby, okay? So I want to make that really clear. We don't recommend any alcohol during pregnancy, but when it comes to breastfeeding, we're now talking about a milk connection versus a blood connection, okay? The percentage of alcohol that's in your milk is a small percentage compared to the alcohol that's in your blood. So even if your baby was to get some, it's a very small percentage of what you're taking in. And the research hasn't really shown to have negative effects in small amounts or in moderation when it comes to giving it to your full-term baby, right? So again, that big difference, I'm going to keep saying it, that big difference between pregnancy and breastfeeding, all right? So don't confuse those recommendations. Don't confuse them at all. Taking a sip, and there's no alcohol in that today. All right, so what about this whole pump and dump issue? Is it really necessary to pump and dump your milk if you're drinking alcohol while breastfeeding? When we look into the science of this, the answer is really no. You do not need to do that, okay? If there's alcohol in your blood, then there's also alcohol in your milk, but you don't need to pump that milk out and dump it in order for it to clear the alcohol. What you really need is time to go by. So let me give you the scenario. You drink the alcohol, you have your beer, you have your glass of wine, you just breastfed your baby, and now it's the longest stretch to the next feeding. So you have a drink. As you drink, yes, that alcohol is going into your blood and it does go into the milk. But over time, as it clears out of your blood, it actually clears back out of your milk. So your milk is not ruined. It does not need to be pumped out and dumped. You just need some time to go by for that to be fine to go ahead and nurse your baby. And that's why I always recommend nursing or pumping right after, having the alcohol right after a feeding or right after a pumping session is really the best time to do it. It's going to give you that longest stretch till you are nursing or pumping again. Okay, so you really don't need to pump and dump. All right, less than 2% of the alcohol that you drink actually reaches your blood and into your milk. All right, so it's really going to be a very, very small amount that's going in anyway. All right, so no pumping and dumping. Breast milk is too precious. It's that liquid gold. You don't want to throw it out. All right, what I would say is if you feel drunk, okay, or if you're feeling the effects of the alcohol, then you're definitely too intoxicated to feed your baby. But that means just wait a little bit longer until you're not feeling anything so that you can go back to nursing. All right, and if you really feel like too much time is going by, well, let's get into that in a minute. Okay, if you need to pump the milk, if you need to pump, if time is going by, you really want to make sure that you're pumping so that you don't decrease your supply. All right, so if you're separated from your baby, or if you've actually had too much to drink, you don't want to just keep waiting to pump. You want to at least get rid of some of that milk so that you are keeping your milk flowing and keeping your supply healthy and not causing any problems like plugged ducts or mastitis or a decreased supply from too long of a stretch between feedings. All right, so that would be the way to do it. And the best thing is just not to overdrink if possible, especially when you're breastfeeding. All right. Again, always keep in consideration the age of your baby. The younger that your baby is, or if their health status is not good, if they're preterm, those babies will have a much more difficult time clearing alcohol out of their system or any kind of substance or medication. So make sure that you are taking that into consideration. The older your baby gets, the easier time they will have clearing this out. All right. So with younger babies, you may want to be a little bit more careful. As the baby gets older, 6 months and more, they're going to have an easier time clearing alcohol out of their system if any amount was even in the milk to begin with. It's really important to understand that there can be effects, but the research has shown not to have any long-term lasting negative effects on the baby. But what are some of the effects that you could see? Let's talk about that for a minute. The babies can show that, you've heard things like that milk can actually be increased by drinking a beer. You've heard this before. I know this is one of those topics that it's like one of those old wives' tales that you hear sometimes, is that drinking a beer can increase your supply. The research does not prove this in any way. In fact, alcohol does not increase your milk supply and can in fact make your baby less willing to nurse, okay, so that the baby's not nursing as well. That can actually have an impact on decreasing your supply because the baby's not latching as well or is interested in feeding, okay, so you want to be really careful with that. It can also inhibit your letdown, and what that means is it makes it more difficult for the milk to come out. If that happens again, that could help to decrease your supply. So you just want to be careful. It's not the alcohol itself, but it's the impact on your baby's behavior or your own ability to stimulate letdowns from alcohol that could actually decrease your supply. This idea that drinking beer increases is really, really not true, okay? Other studies showed that the babies had sleep patterns, short-term and small amounts of alcohol consumption, they slept less. All right, so we don't want to make our babies sleep less. And so this could be an issue that you might see with alcohol consumption too. And then also daily consumption of alcohol with breastfeeding mothers, which can be shown, this is on a daily basis, has been shown to increase a baby's risk of slow weight gain and also a decrease in gross motor development. All right, so again, all in moderation. We're talking about an occasional drink, not daily consumption. And when you do it, to keep it to really small amounts in moderation, so that, and the longest stretch between feedings. We don't want to feel the alcohol and feed our babies, all right? So bottom line, okay, if you're drinking in moderation, and you want to make sure that you're sober enough to take care of yourself, and that you're, if you're able to operate a vehicle, you're most likely able to go ahead and feed your baby. It's a great way to judge how much have I had. All right. The reason the baby only receives a fraction of what you're getting in your milk, only the baby's receiving in their milk only a fraction of what you're actually drinking. So it's usually very safe to do this. The greatest concern that we usually have is that if you're intoxicated, that you could accidentally drop the baby, or fall asleep, have some kind of unsafe conditions like that, all right? And forget to either nurse or pump. So these are the things you want to be careful of. Obviously, again, moderation. And if you're going to have more than that, make sure that you've set up some kind of a backup method, somebody else to watch the baby, and some pumped milk ahead of time, so that your baby will be able to eat, okay? Your baby's safety and their physical safety is obviously number one. And contaminated milk with alcohol is very unlikely for a mom who's drinking moderately, but we want to make sure that their physical safety is completely taken care of, okay? So here's a few tips I can give you just to wrap up on alcohol in breastfeeding, okay? Enjoy your drinks without shame, in moderation. Parenting's hard enough, and it's even without giving up something that you enjoy and to have when you want to be social, okay? Take your baby's age and health into consideration when you're doing it. Eat a nutrient-dense meal and maintain good hydration while drinking alcohol. Make sure that you stay hydrated. Alcohol can dehydrate you, which can have an impact on your milk production. So make sure that you're eating as well, and that you're also drinking lots of water. If you're going to have a drink, have it right after a feeding. Make sure that do it right after you either feed or you pump, so you have the maximum amount of time until the next feeding, okay? Have a partner or your support person care for you and the baby, okay? Just in case you get intoxicated and it's unexpected, you might not have had any drinks during your whole pregnancy, which I hope you didn't. And if that's the case, it could hit you harder than you think. So you want to make sure that you're always having some kind of support with you, all right? And then listen to your body, and remember that, it's because it's been a year, like we said, most likely you haven't drank in a while, and, and your limited sleep too could really impact how that alcohol affects you and your tolerance to it, all right? And also, last thing I wanted to mention about this was, avoid putting too much trust into these alcohol test strips, okay? I'm not really a big fan of that at all, or any kind of online calculators. Really, the best thing to do is to just let time go by, see how you're feeling. They're not as accurate as, it's not something that I would accurately depend on to make decisions about how to feed my baby. There's too many variables, and they can be really unreliable. So I would just avoid that altogether. Let that time go by, drink in moderation, and see how you feel. Listen to your body and be safe, okay? So I hope that that helps, and that will guide you in your breastfeeding experience here, to make things a little bit easier and to go ahead and enjoy yourself as well.